Cancer is the most common cancer worldwide, accounting for 2.1 million new cases and 1.8 million deaths in 2018. In South Africa, lung cancer is among the top 3 cancers in men, and in women, lung cancer is ranked 7th. It is also considered one of the top 5 cancers that puts patients at risk of disease and possible death. There is low awareness of lung cancer in South Africa because early diagnosis is key. It's important that people learn to recognize the signs as well as the symptoms of this common but serious disease. Joining me now is oncologist Dr. Ronwyn van Eeden. Good to have you on the program this afternoon, Doc. Firstly, lung cancer is ranked among the top 5 cancers in South Africa, affecting a significant number of individuals. Could you provide an overview of the current landscape of lung cancer in the country and also its impact on public health?
Thanks very much for having me on the show. So as you correctly stated earlier, that lung cancer is more common in men than in women. And in men, it's the 3rd most common cancer in South Africa. There's different types of lung cancers that get approached differently and treated differently. I think the important thing about awareness about lung cancer is that a lot of people have a perception that it's just in really old people or heavy smokers. And actually, we've got a population of patients that can be affected by lung cancer who are also young or never smoked. So it's very important to have an awareness about it and understand the signs and symptoms of lung cancer so that we can be aware of it and, most importantly, pick it up early. The problem with lung cancer is that it's, even though there's been a lot of new innovations in lung cancer and different treatment revolutionized lung cancer management, it's still the leading cause of death in cancer patients worldwide.
Now, as you say, early detection is often emphasized as a crucial factor in improving lung cancer outcomes. Could you explain why early detection is so vital and what steps can individuals take to recognize potential signs and symptoms?
So I think the difficult thing about lung cancer is that often when it's very early, there's not a lot of signs and symptoms that patients can pick up. There's also a very limited screening program for lung cancer. So, generally in patients, it's not like breast cancer where you can go for a yearly mammogram or cervix cancer where you can get a pap smear. There's no specific screening guidelines for that. About 60% of lung cancers will actually present with advanced stage or, where they've spread already or have metastases at diagnosis. So things to remember is that if you have any symptoms that are persistent and that are not letting up or that just don't feel right, is to seek help. So things like that would be a cough that's not going away, for instance, and you've been treated repeatedly with antibiotics, or it's been a couple of months and there hasn't been any resolution of symptoms. Or even some patients can present a little bit later if, the cancer spread with persistent pain or discomfort in a certain area of the body. Other things to look out for is also weight loss that's unexplained or excessive fatigue. And just really what I always say to patients, if anything is nagging or going on for longer than usual, is always to seek help and to look for another reason if the current treatment that you've been having hasn't been helping you.
It's also noted that for every 320 scans conducted, one life potentially can be saved from lung cancer. Could you elaborate on the importance of diagnostic imaging in this early detection of lung cancer and the advancements in this area?
So basically, in terms of screening or radiological detection of lung cancer, usually what we would say is that our basic screening tool would be a chest X-ray. So usually if patients are seeing their doctors or GPs for long periods of time with persistent coughing or something like that, is to start with the basic chest X-ray. Other imaging modalities that we can use in patients that are very high risk is things like low-dose CT scans. But then we also use many different types of modalities for imaging lung cancer, such as PET scans, MRI scans for brain imaging specifically. So there's actually quite a wide variety of different tests we can do. But generally, we start off screening or with a basic investigation, such as a chest X-ray.
Now, as mentioned, smoking is a leading risk factor for lung cancer. With a considerable percentage of South African males and females being smokers, what strategies or resources are available to indeed support individuals who want to quit smoking or even reduce their risk?
So that's a difficult one. I think it's very hard, in a patient that's a smoker to convince them of the possible risks and, to encourage stopping smoking. It's a very difficult thing for patients, but obviously for us to create awareness out there that smoking is the leading cause of lung cancer as well as other cancers as well. I think also it's important to remember that there's a small population of patients also that have never smoked before that can also develop lung cancer. So I think in terms of encouraging patients and advocating for stopping smoking, it's always a difficult thing, even as a doctor, to convince patients to stop smoking. So it's hard, but also to kind of encourage other healthy measures in lifestyle, such as healthy eating, exercising, limiting alcohol intake as well, and decreasing exposure to like pollutants and carcinogens and those kind of things. But it's very difficult to get someone to stop smoking.
It's very difficult, very, very difficult. Now, other than smoking, what are some environmental and occupational factors that can also raise the risk of lung cancer? And also, how can individuals mitigate these risks, especially if they have a family history of the disease?
So lung cancers aren't generally always hereditary in nature. So I wouldn't necessarily say if you've got a family member with lung cancer that it increases your risk that much more significantly. But also obviously there's some occupations that increase hazards that some patients can't help but to be in an environment. But important things is always to make sure that there's good aeration, also that not to sit also in company where there's a lot of smoking or passive smoking, those kind of things. Just to kind of try to limit exposure to it in your environment if possible. So that's also difficult in terms of some patients' occupations and where they work. But it's also important for us as doctors to take good histories from patients and see those patients also that are high risk and kind of try and think of a way to screen them or detect diseases earlier in these patients.
Now, the two main forms of lung cancer are a non-small cell lung cancer as well as a small cell lung cancer. Could you explain the key differences between these two types of lung cancers and how they are typically treated as well?
So those are the two broad categories. Small cell lung cancer accounts for about 30% of lung cancers. It's not as common, but small cell lung cancer is almost always associated with smoking. And this type is the more aggressive type of lung cancer. So these patients tend to have disease that's very aggressive, that spreads very quickly and early in the disease. And also in terms of outcomes, do a little bit worse in our non-small cell population. Advances in the treatment of small lung cancer is basically the addition of a newer therapy, such as immunotherapy, to our standard of care, which is chemotherapy. Often these patients will respond well to therapies, but unfortunately the response is usually, a short duration of response, and they can relapse quite quickly. Non-small cell lung cancers, then the most common group of lung cancers, they account for about 85% of total lung cancer volumes. And they divided into three main groups called squamous carcinomas, adenocarcinomas, and also large cell carcinomas. Squamous cell carcinomas are also more commonly associated with smoking, and they tend to also be less responsive to therapy and a bit more aggressive. Whereas adenocarcinomas, there's been an absolute boom and a plethora of different types of treatments that we can use there as well. Often in adenocarcinomas, sometimes we can pick up things called driver mutations, which is a type of abnormality or a driver that causes the lung cancer growth. And what's different there is that we can often use something called a targeted therapy, which comes usually in an oral formulation that can be used to treat these types of lung cancers. And these will generally be found in the patients that are non-smoking. And then generally, what's also new with lung cancer is that we still use a lot of chemotherapy, but also what we try to do is incorporate immunotherapy into our treatment regimens. And what immunotherapy basically is and how it differs from chemotherapy is that it uses the body's own immune system to be activated, and then your immune system assists with killing the cancer.
Right.
So there's a lot of new developments and a lot of new therapies that we can use. I think it's almost always important to advocate that, that patients are also aware of these newer therapies, and that there's certain testing that can be done on the lung cancer biopsies that can give us an indication as doctors to which therapies we can use. So there's a lot of testing, such as next generation sequencing, which guides us in terms of targeted therapies and also specific therapies to see which patients would be more likely to respond to immunotherapy on its own, or it's warranted to use different combinations of therapies as well. The one point I want to make as well is also that there's also clinical trials available in the country. So for patients that maybe don't have access to the newer therapies, is to always ask about what clinical trials are available for the type of lung cancer so that they can get exposure or access to some of the newer therapies that are available.
Well, thank you for your time. That's oncologist Dr. Ronwyn van Eeden providing us some valuable insights into lung cancer treatment as well as detection. Remember, early detection is key.